My name is Joe Cates. I'm a general and vascular surgeon. I'm part of a 9-man group and we cover 5 hospitals in Kansas City. I chose vascular surgery, namely because I thought it would extend my general surgery skill set. General surgery is the overall surgeons, and so essentially with general surgery you do a little bit of everything. And so to increase the expertise to do vascular, it's an added qualification. In a standard week, I would typically do 3 or 4 major oncology operations like pancreatectomy or liver resection or esophagectomy, and probably 5 to 10 vascular procedures. And then the marriage of those two I think is really the most important, because there are times in oncology surgery where you involve large blood vessels, and sometimes traditional oncology or general surgeon might shy away from that, and essentially that's in my wheelhouse, so I kind of embrace that. My approach is to get to know the patient. I don't use computer entry myself. I sit and talk to the patient, look at them. I have a person in the office that takes notes and helps me with that, but I don't want to be isolated by sitting behind a computer. So I think getting to know those patients and drawing pictures and helping them to understand what we're proposing is extremely important. When someone's going to undergo a procedure, they ultimately have to have trust. And I think in terms of their recovery, it's extremely important. When patients know that you have their best interest at heart, and you know that you've been honest with the risks and the benefits and the reasons that we're doing these procedures, the recovery is so much more reliable and improved.